Stages of general anesthetics. Today we'll discuss about this. What are various stages of general anesthetics? In 1920, Gordon he studied about the various stages of anesthesia by using the gaseous anesthetic ether. So how he studied the anesthetic technique or the anesthesia by using ether? So based upon the symptoms or based upon the symptoms they revealed, and it is divided into various stages, 4 main stages. So the first stage, stage 1, 2, 3 and 4. So it is broadly divided it into 4 stages. The first stage is called stage of analgesia. So you know what is meant by analgesia. Analgesia is nothing but pain relieving or loss of sensation of pain. Okay. So the stage. Okay. So when general anesthetics he studied or he described with the help of the gaseous anesthetic. So it starts from the induction. You know what is meant by induction. So the administration of the vapors of the drug and to the loss of consciousness. So it starts from the induction and to the loss of consciousness. This is the first stage. Okay. So and the pain is abolished. Then the patient they are in dream-like state. So these are the characteristic feature of the first stage. And when coming to the pupil size, these are the parameters they use to denote the patient, or they will analyze in which stage: the pupil size, respiratory rate, heart rate. Okay, so everything it remind and muscle tone. Okay, so with the help of these they'll come to they will analyze the patient or in which stage. So pupil size is normal, respiratory rate is normal, heart rate, everything is normal, and about the muscles it is completely relaxed. So this is the first stage, analgesia. Now coming to the second stage, stage 2, it is called delirium. So delirium is nothing but excitement. So it starts from, so first stage, that is still the loss of consciousness. So it has to start from the loss of consciousness till the beginning of regular respiration. So delirium is nothing but excitement. So of course the patient characteristic features, what are the characteristics or what are the symptoms they revealed is aura or shout. Okay, so they'll make a loud noise, they'll shout, and the jaws are tightly closed, stiffening. Okay, and the muscle tone is increased, heart rate, blood pressure, so everything it is increased. Then coming to the pupil size. So first stage it is normal. Here it started increasing. So it is called dilated pupil, increase in the size of the pupil, and the heart rate, everything it started increase. So and irregular breathing. So this is the characteristic, and in this stage or it is not suitable for the surgery. Okay, so like this the surgeon will analyze the patient whether they are in first stage or second stage or third or fourth stage depending upon the parameters. Next, moving on to the stage 3. This is very interesting, and the third stage is called surgical anesthesia. So in the name itself it is there, surgical anesthesia. So it is suitable for surgery. Okay, so it starts from the regular respiration to the cessation of spontaneous breathing. Okay, so it starts from the regular respiration. So respiration, everything, it is coming back to the normal. So the surgeons, or we can increase the, or gradually we can increase the anesthetic dose. Then it is, again it is divided into 4 planes. Okay, so plane 1, plane 2, plane 3 and plane 4. So in the surgical anesthesia, or in the third stage, we can say it is divided into 4 planes. So what is plane 1? Plane 1, once again, plane 1 is nothing but revolving eyeballs. Okay, so it starts from the revolving eyeballs till the eye is fixed. This is plane 1. Plane 2. Plane 2 is nothing but loss of corneal and laryngeal reflex. You know what is mean by if you are placing anything on the cornea, they are unable to respond. Corneal reflex. If you are placing anything into, or if you are that is endotracheal intubation, if you are doing this, there is no reflex. So laryngeal reflex, loss of laryngeal reflex. Then that is called plane 2. Plane 3 is nothing but the pupil starts dilating and the light reflex is lost. So we can check by using the torchlight or anything. If we are focusing it on the eye, so they are unable to close the eyelid. This is the loss of light reflex. So this is the most suitable plane for performing surgery. So stage 3 and plane 3. And in plane 4, we can say shallow respiration. So the respiration is getting reduced, shallow, below the normal level, and dilated pupillae. So this is stage 3. And most of this surgical procedure they did, or they'll perform in stage 3. The last one is stage 4. Stage 4 or medullary paralysis. So this is the even the higher concentration of general anesthetics, but it is not the preferred phase or stage for performing surgery. Or if you are increasing this dose, the patient may, or it results in the circulatory failure. So it starts from cessation of breath. So they complete arrest of breath and failure of circulation, and at last it will lead to the death of the patient. So in this stage, or we have to avoid, or we have to prevent this stage 4. This is called medullary paralysis. So these are the various stages of general anesthesia, and Gordon studied by using ether.